So it's always good to kind of try to give them something that they can be compliant on their dosing. Take it all till it's all gone. Don't save it. Don't give it to the neighbor. Don't give it to the other kid. For it to be effectively treated, you have to give the full course until the bottle is empty. Don't go Q-tips in the ears. They actually do make this Q-tip. I don't know if y'all have seen them. It goes kind of like this. That only barely goes in, so you can kind of clean the outer part of their ear, but you don't actually go all the way into the canal.
Ooh, but it feels so good.
Because you do have those kids that kind of they make a lot of earwax. So you do kind of have a way to remove it. It's there for a reason. We don't want to totally take it away because it makes the canal moist. My brother and I fight about this all the time because he always talks about his ears are itching. I'm like, because you use a Q-tip every day. You remove your wax, makes it dry and itchy. So stop that and your ears will stop the itching. Frequent ear infections like Travis mentioned and my daughter had, it gets to a point where the child is constantly having an ear infection. You are constantly on antibiotics, you get diarrhea, you miss school, you don't feel good. It gets to a point where, okay, let's go to an ENT and get ear tubes put in. And it works really well because it helps drain all that fluid out.
I just remember it was super fast, like a 20 or 30 minutes.
The worst part is being MPO after midnight, waiting on this procedure. We were in the waiting room, and there was a guy there eating breakfast, and my daughter walked up to him and was like, so I had fed her that morning, but she didn't understand. I still remember that. So anyway, ear infections interfere with hearing, which therefore interferes with speech development. That's why ear infections are so crucial to treat and treat appropriately, because it's going to affect language. And if they can't hear, they're not going to talk.
How do they check that? Like,
How many words they're talking?
So you may have a child that just does a lot of pointing, or their words they should be speaking are just a few. They should be speaking maybe 15, 20 words. Maybe they're only speaking one or two.
They could do like another hearing test.
They can. It's called an audiology exam, where they actually go to the ENT and put them in this like really tight, soundproof room, and they do all these frequencies. More than like the little earphones that we do in the doctor's office. It's more high tech than that. All right. So we've already talked about ear infections could interfere with language development, speech development, hearing. There are babies that are born, so when you see the word congenital, whether it's talking about a heart defect or anything, that means the child was born with it. Don't forget that. That's not something that they have developed. They came into this world with this problem. Okay, we see babies with congenital hearing impairment. That's why in a newborn nursery, they do hearing screens before they send these babies home. They check both ears. And if one of the ears, there's a fail, they have to repeat the test again. And if there's a fail again, they're sent to ENT. So, did y'all have to have medical terminology for this program?
No, I'm not sure.
The RN program does not either. It's a huge deficit. So what I do, I see words because I'm aware of that, and now I know that with y'all as well. I try to break down the word just so that you understand it in case you don't ever. I had a student in the RN class say, oh, I just skip over a word when I don't know it. I'm like, oh, don't say that. So sensory neural tells you that there is a nerve reason why the child cannot hear. Okay, it's a neural problem. Whereas conductive, it has to do with sound, receiving sound, and vibration on the eardrum. So they're completely two different. And they can be combined. Some kids have a little bit of both. And then once they get 3 years old in the doctor's office on the adult child, they'll put the little headphones on and they have them raise their hand when they hear the beeps and all that. These are some of the signs and symptoms you may see of a child that does not hear well. If you see a baby laying in a crib and you drop a Stanley on the ground, the baby should go like this, startle. But if the baby keeps sleeping, that's a sign that they're not hearing well. Or you call their name and they don't turn their head. Cochlear implants are the little, that's kind of like the head back there. When we identify, see, that would have invoked a startle reflex when you brought the phone. For a child that has hearing impairment, you know, you want to try to teach them to read lips. You don't raise your voice. You use other means to communicate, hand gestures, pictures, things like that. We always get them in speech therapy because if there's hearing involved, there's speech involved. So they go hand in hand. So they will go to speech therapy. Obviously, hearing is not just for hearing things, but like how we learn and answering questions, but for safety reasons, if you have a child that can't hear and there's an emergency kind of situation, you have to think about how you're going to get that child's attention. Okay, there's a fire in the house and they're in another room, something like that. So, questions about ears, otitis media yet?
Yeah, I was gonna say, because of my son's ears, he was a little bit delayed speech-wise. We didn't realize it until he was 18 months, because we went for his 1.5 year checkup, and my other son's 1 month checkup. And they're like, is he speaking 6 to 12 words? And we're like, no, like 4 or 5, like mama, dada, bye-bye, baba, you know. And then, so we went to that, there's some in Galveston, it's like a clinic for the sound or speech.
Audiology?
Yeah, and they said he wasn't far enough behind to start, but if he doesn't start talking in the next 6 weeks, then he is. But the minute we put him back in daycare, I just remember the first day he came home and he's like, tree, and he'd never said tree before. And it was like every day, because we took him out of daycare because we didn't leave my brother sick. But the minute he was back around other kids.
But they learn, they get socialization skills, they
Right.
start mimicking other kids'
Right.
behavior, which can be good or bad, so
Right.
it's actually a good thing.
Right, it was just one of those because she was on
But it
maternity
does,
leave.
they are sick, I
Yeah.
mean, that's hands down. But I will tell you, the ones that don't go to daycare, when they go to preschool or kindergarten, are sick all the time in public school, so they're still gonna get sick, it's just when do you want them to get sick?
Right.
When they're a toddler, or when they start school. They just have to be exposed to all that stuff. So, obviously we check vision as well, not just hearing. We want a 4-year-old to see 20/40. So remember 4/40 in both eyes. Okay. For mass screenings, like in a school, 5-year and up, we screen them to 20/30, and then they're a pass. If there's a differentiation between the two eyes, like a 20/30 and a 20/40, that is a fail. So we're going to refer them out. The Snellen chart is the big E chart. You'll also see the HOTV, and the reason why they pick those letters is because they're all very different. And a 3 or 4-year-old may not know their letter B or D, but they're going to know an H because it looks so different, and they're going to know it's an O, or they may say a ball. So you may see a HOTV chart, and these are the symbol charts. Amblyopia, or lazy eye, is loss of a vision due to favoring of the other eye. It's actually more of a brain muscular thing. So we actually patch an eye. Which eye can we patch? The good one. We want to trick the brain to use the weak eye. I had a friend that had this. And one of my nieces. So the strong eyes is patch, forcing this one to line up and the brain to acknowledge, because the brain will kind of discard the weak eye and just focus on the strong eye. So patching and lots of appointments to the ophthalmologist. Classes. Strabismus. Actually, I said that wrong. Lazy eye is a muscular issue, eye muscle issue. Strabismus is the brain where it actually shuts that eye off. And it can cause it can cause blindness in that eye if it's not detected very early. So by 12 months of age, if that eye does not line up, it's going out or going in after 12 months, they should be seen by a pediatric ophthalmologist. So you want to catch this, because this eye here would end up losing vision, and seeing this one would be the only one. How do y'all think we can pick up on this? Okay, this one, we can kind of see, if you're looking at somebody that their eyes are aligned. How about this one?
Probably when they're grabbing something, like the pincher.
The eye doesn't move? Or is that
So
both?
we do what's called a cover-uncover test. So say I'm standing here with my right eye covered and I'm reading the letters, and then I go to remove this eye has trailed. So this eye that was covered during the cover-uncover test does not stay straight. It goes in or out.
And that is the,
Strabismus, brain shutting off. So the cover-uncover test, we're going to be able to pick up on strabismus, and it can go, like I said, it can trail in or out. So you want to watch that covered eye after it removes. Yes.
the lazy eye will still stay straight.
Lazy eye will, it's not pointing center, it may tilt in a little bit or tilt out. But usually they can go like this and blink, and it kind of like brings it in. Lazy eye is more muscular. I said it wrong initially. Strabismus is the one that is, they can't control. It has to be, they can't blink real hard and fix it. It's the one the brain shuts off. Does that make sense? Surgery might be indicated, special glasses, also maybe patching. You may see this in kids with other neurological defects. Maybe cerebral palsy, which we're going to talk about. You might see some eye variations in some of those kids.
Is the Brown syndrome, that would be more muscular, or would that be something with the brain? Brown syndrome.
Brown?
Mm-hmm.
Brown syndrome?
Mm-hmm.
What's Brown syndrome?
It kind of looks more like this one, where, for instance, my daughter, she has a thing where, like, we used to call it the crazy eye, and it just looks like that was the one that was moving real crazy. We thought it was a crazy one. When I took it to the doctor, it was actually the one that was looking straight forward was the one that was the problem. Like, she would look up, and it would just be one, like, say she tried to do a certain movement where her eyes should follow together. It would be that one eye that was just moving all around, but that was the one that was actually doing what it was supposed to do.
You
And
have
the other one
to
was just
definitely check visual acuity to see how far they can see on both eyes, whether one's straight or not straight. So we're going to test both eyes individually.
Okay.
But the cover-uncover test will show the movement, but we're still going to try to get him to tell us, read these letters on the wall.
I'll try
See
that.
what
I'm going
his
to try that
vision-
one on her. Yeah.
His vision is. Yes.
They didn't go through that yet.
Did you ask a question?
Yeah. Never mind. I'll talk to you over.
So, do y'all need me to go over that again?
No.
I'm gonna YouTube it.
Huh?
YouTube.
Showing a lazy eye? That's probably
YouTube,
good.
like when you put those diseases, it will break it down.
No, that's good. And for those who like pictures and visuals, sometimes that really helps seal the deal.
See, what I was gonna ask is about not the eyes themselves, but like my daughter, one of her eyelashes, it seems like one, like when she,
Eyelashes or lids?
well, both, yeah, the eyelids, sorry. And, but we noticed that when she was a baby, she'd drink a bottle, but it was like only one eye would like
So
move.
she has ptosis, P-T-O-S-I-S.
Okay. But it was like, it's
Where-
never affected her
Where one
vision.
kind of is a little lower than the other
At times, yes.
when she's tired.
you just, it's, you know, a lot of times when she's eating, we'll notice it, like one eye moves not as much as the other, but it's just the eyelid, you know? And but they told us not to worry about it, she's fine, she sees and everything, but it's like, but you'll notice a lot of times in like photos, it's like one eye's not open as much as the other.
So that's called ptosis.
Okay.
And it could be associated with conditions or just totally normal kid with one eyelid that one eye is wider than the other. That's all it boils down to. Okay. Pink eye. We all know this, right? Can be viral, can be allergic, and can be bacterial. Okay. Can be unilateral, one eye, can be bilateral. Main thing I want y'all to remember about pink eye is it's highly contagious. If it is with copious secretions like thick green, glued in the morning, we're going to treat it as bacterial. We're not going to put them through a culture and all that to find out if it's bacterial or viral. Put them on an antibiotic drop. Treat both eyes, even if the other one isn't affected, because it will be affected. There's no way.
Yeah.
I don't care what kind of hygiene you have, how old you are, it is very, very hard for it not to pop over to the other eye. And if we delay treatment, we go from treating for 7 days for both eyes, we treat 3 days here, and then now it's over here, now we gotta add another 7 days over here. Be real careful with your technique when you're adding drops to the eyes. You can pull down the lower lid and make sure this is the conjunctiva actually down here. A lot of people, when they say pink eye, they think it's the white of the eye. It is red, but we're looking at the conjunctiva, which is the pocket down in the lower lid. That's where we want those drops to go. Drop it down, put a drop. There's ointments, which are a little messy, cause blurry vision. We use it in younger infants because they're a little safer. Older kids, 12 months and up, we're going to use a drop. And usually the drops are 2 to 3 times a day for 7 days. So back to the otitis media, it's a 10-day treatment for oral antibiotics. Usually a topical is a 7-day treatment. 24 hours back to daycare or school, just like everything else. 24 hours. The nurse is preparing to instill eardrops in a 9-month-old baby's ear. What should she do? I'll know this by now.
Down.
What is an early sign that a 2-month-old may be hearing impaired?
That's an ear infection.
Oh, ear infection.
Early sign. Keyword, early.
Startle. Probably startle.
See,
Startle.
startle.
la-
Frequent pulling of the ears the word frequent doesn't mean it's not early. He's been having repeated ear infections. Nervous system. You don't have to learn cranial nerves.
No, they
Oh,
didn't make us learn.
goodness.
Oh, we do?
You do not.
Oh,
I don't think I learned that until my master's program.
Oh my gosh, my anatomy teacher.
Well, I mean, yeah, that's true. Yeah, but that was short-term memory. I forgot it after. So the best way to assess the nervous system is obviously level of consciousness, okay? In a 3-year-old, it might be asking, can you tell us your name and your birthday? They know that. Enough about that. Sepsis, infection, depending on the age of the child, the symptoms are going to be different. So an infant that's septic at home maybe has a really, really bad urinary tract infection, maybe high fever, irritability, Maybe lethargy, maybe they're very lethargic, eyes kind of roll back in their head. We'll definitely see that on those kids with vomiting and diarrhea that are getting dehydrated. Take them to a clinic or in the hospital. They're going to check urine and blood and maybe do a spinal tap to find out what's going on. Meningitis. So, one reason why we treat, y'all just had OB, why we treat moms that are diagnosed with group B strep. Did she talk about that? The importance of getting that mom's a couple doses of antibiotics before she delivers. So in a child, they can tell you they have a headache. In an infant, they're going to have a really high-pitched cry, super irritable. And remember, meningitis, brain and spinal cord, so super irritable. Anytime y'all are dealing with a child that has any type of neuro problem, you need to control the environment as much as possible. They're not going to be in a semi-private room. They're going to be in a private room with dim lights. The blinds are closed, minimal visitation, no noise. So think about all the external stimuli. If you have the worst headache you've ever had in your life and increased intracranial pressure, we got to do what we can to minimize your symptoms. Okay? So think about the environment and how important it is to minimize all that stimulation. Vomiting is not from a stomach bug, it's from increased intracranial pressure. Think about our kids who have concussions and they have a head injury. One of the first things we ask them, are you vomiting? Because they have vomiting, forceful vomiting without nausea. That's from increased intracranial pressure. So think about that. Some kids with meningitis will actually have seizure activity. So we need to think about seizures. Y'all know what petechiae is? Mm-hmm. A meningitis rash kind of looks weird, looks different than anything. It's kind of more purpley. Red rashes are kind of normal. You see a purple rash, take the baby to the ER. Always. Meningitis, we do not wait for cultures. We get that spinal tap, we send it off to the lab, we start immediate IV antibiotics because it's a rapidly progressing infection of the central nervous system, and this is why we get the meningococcal vaccine to go to college, because there are students that have been in college in years past that got meningitis that died because it is so rapidly progressing. So on antibiotics, checking those cultures, finding out if it's a bacterial or a viral source. Super high fever, so we're going to give them medications to bring that down. Anticonvulsants if they are having seizure activity. We've already talked about the importance of the environment. That is what I want y'all to focus on. Okay. Minimize stimulation. Watch those vital signs, including neurovital signs. Private room. Got a question, Brooke? Oh no, you're just stretching. Y'all heard of febrile seizures?
Yes.
A little different. Okay, these are usually a one and done. I do know kids that have had more than one. We don't see it after age 5. Happens up to age 5. Pretty prevalent in families. If you have a kid that has one, you will usually hear them say, "Oh, my aunt or my uncle or my whatever, her brother did it." So. And it's not from a super high fever, it's a rapidly increasing fever, so temperature. So say they were about 99.4, and then 30 minutes they're 102.5. So they've risen 3 degrees in like 30-minute time. That's kind of what makes them seize, is that rapidly raising temperature. does not turn into a seizure disorder. It's kind of its own entity. Okay, so, like I said, it could be a one-time deal. Epilepsy, I don't really want y'all spending a lot of time on this when you're reading and studying, okay? Just know, if a child has a seizure, more than one, that is their diagnosis. They have epilepsy. But I don't want you to get in the weeds in the textbook because you're going to see all these types of seizures. Grand mal, absence, partial. Don't go there. Think about safety when it comes to seizures. What is our number one priority if we're in Target and we see somebody fall out on the floor? What do you got to worry about?
Okay.
Safety. If they're sitting there next to a buggy, move the buggy. Get them away from the wall. Okay? Seizure activity can be violent enough they can break an arm or a leg or have a concussion and not even know it. So move movable things. Okay? How do we position them? Why? Tongue will fall out to the side, so keep your airway open. Secretions will fall out by gravity. Do we put anything in their mouth? No. Including your fingers, tongue blade? No, nothing.
How many, you said more than, how many?
More than one, sir. I'll just make a couple points about epilepsy. So just when you're thinking about this, just think about seizures in general. Some kids do not respond to seizure medications, no matter which one they try. They'll put them on a keto diet, and for whatever reason, high-fat, low-carb diet, it controls the seizure activity. Very interesting.
And is that the one that called status
Status yes, that is hard. Epilepticus, yeah. Yes. We try to manage seizure disorder with one medication. Why do y'all think that's the case?
Adverse effect of other medications.
Yes, that's part of it. Do you know which one's working?
The kidney.
Mhm. If you don't know a lot about medications or classifications about medication, let me just tell you one thing that you'll always remember that I said this. If there is a classification of medication that does not play well in the sandbox with others, it is anticonvulsant. Hormones, antibiotics. You have to really, if you find somebody's on seizure medication, you got to really do your research if you're fixing to prescribe them something, because A, is it going to be absorbed at all? It may totally block it. B, will it increase the absorption of the seizure medications where they're not in their maintenance medication
Regimen.
therapeutic range.
Mm-hmm.
Herbal preparations. Anyway, it's a mile long. So just know that seizure medications, somebody's on phenobarb or Dilantin or Tegretol or Keppra or whatever it is, just be really cautious. Do your due diligence and look in your drug book and make sure that there's no interactions, because there's a ton. So,
And also about when they take it. There's
Timing.
not a man where I work that they had him taking it, but then he was going to dialysis right after, so it was just
wow.
yeah.
That's a no-no.
My goodness. Wow, that's very interesting. And another thing about these type of medications, you really should do peaks and troughs. You know what those are, where you give the drug, you take some blood, you want to make sure they're in a certain level, trough, draw blood right before the dose. You want to make sure they're not in a toxicity environment or a totally non-therapeutic environment, which sounds like that's supposed to be. That is crazy. So anyway, remember how I always say, no matter what condition we're talking about, you never not do ABC. I don't care if it's a rash, a burn, whatever. Always do your ABCs, then look at everything else. So, same with this. Safety, got an airway, they're breathing, has circulation. You got somebody who's called 911, don't leave their side, stay with them the whole time. Cerebral palsy is basically a chronic neuromuscular condition where kids just don't really have control of their whole musculoskeletal system. This might be a baby that was born with a cord wrapped around their neck. Maybe there was some type of an ischemic event when mom was carrying the baby during pregnancy. So some type of brain damage. They may be very stiff. They may kind of have spasticity. They kind of tremble. You've probably all seen them that walk and they kind of turn their foot in and they have a really pronounced limp, like they're going to fall. You may see them in wheelchairs. They may have contractures where their arms are like this. So most likely that was cerebral palsy. Notice that.
Can it come like when you're an adult?
When you,
Like you don't have to be born with it. Like if what accident that can happen to you.
if it happens when you are still going through a normal growth and development, it can affect your progression of your normal growth and development. Again, I know I have this on the slide, spastic and athetoid, do not study that. Just think about what is the condition? Can we fix this? No. These kids are going to be in occupational therapy, physical therapy, maybe speech therapy. They may not be able to chew well. You may have to kind of hold their jaw to help them eat. Aquatic therapy, they may be in the pool, obviously with others for safety. Trying to use those muscles and keep those, get that non-weight bearing movement in the pool. You heard me talk about way back when kids aren't growing, they're not developing, and these kids typically will have delays in their milestones. So there's a delay in holding their head up or rolling over or sitting up. There's like another delay and another delay and another delay. You may find that they only use one side of their body. Mom might say that they never move their left hand or left arm or left leg, like or something like that. How do we treat this? When there's spasticity, there's baclofen pumps that we can do. There's other types of medication. It controls the symptoms, but it doesn't really fix their problem. Okay. When there's seizures, we're always going to treat for that as well. These kids may be very undernourished, with like osteopenia. I have a very good friend who's got a severely delayed child, and they were changing the diaper and broke her femur. Her bones are that brittle, and this is like a caregiver that like is always over there that she trusts. So very sad. Or they're overnourished because they're not active. Maybe they have really mild CP, but their appetite is good, and because they're not very mobile, they're kind of on the higher end of their BMI. So it's kind of a fine line with these kids. These are some of the things you might see. This looks like play therapy in the hospital. Again, we can't fix the problem. We want to try to maximize their normal life as much within their scope. obviously early recognition and early intervention is key. You're gonna have a better, I tell this story too. So my first cousin has CP, but she's a pharmacist, believe it or not. So her mom, my aunt, was already went to nursing school at San Jack where I went. She noticed some behaviors and took her to the doctor, and they diagnosed her. She has a significant limp, turning in over one of her feet, but no intellectual deficits at all, to the point where she's super smart and is a pharmacist. But when she walks, you can tell something's really wrong. So some kids have the physical deficit and not this. Some have this and that. So it's definitely varied from case to case. And obviously, when we identify, we actually call this cognitively impaired. Now, we don't really use the word intellectual disability or brain damage.
So the R word.
Yeah. Yes, exactly. Be careful how you term things.
Yeah, I didn't realize it until a couple years ago. I was in lifespan development, and I said the word midget, and like half the class went, "Oh, I'm like, I
Yeah,
don't
they
know."
don't
Apparently,
like
there's
that now. It's
well, there's some show apparently I've never seen called Little People or something.
There is.
I was
She
like,
was a pediatrician at Texas Children's Hospital.
but I was like, hasn't medically been called a midget for like the last 150 years? Like, when did this change?
Oh, the one who passed, the older one? The older lady one?
I know it was a mom, pediatrician. I actually saw her one time in the hospital. I was like, oh my gosh. I don't know. I need to Google that. I haven't looked at that in a long time. Dwarfer, is it dwarfism is now what they prefer using?
No, they want to be called little people. Apparently.
That is crazy.
I was like,
I need to get off of
literally
that.
said- because the whole class like gasped, and I was like, when did this mass go out that we're no longer allowed to say the word midget? Like, that's the medical term for a short person.
But you know what? You have to admit, midget. What does that like sound the best?
It's the
But it's
medical
actually a term, like,
It's the medical term.
It's a-
Mental retardation, but we don't call
I know,
people
that's what I'm
that
like.
either.
yeah,
I
you
know,
saying
the
it's
same
like,
thing.
but I mean, I have a friend that's a midget, and she's a midget. Like I'm a midget. But if you talk to them, you have a dwarf and you have a midget, and they'll tell you, no, I'm a midget, she's a dwarf, or I'm a dwarf, she's a midget. It's a difference in the height. It's a difference.
Some difference. You're right.
It's a real term. Yeah.
It is, but
Yeah, it was one. She was in ROTC in Galveston. Everybody knows her, and she'll tell you no.
So she
And they
doesn't
like to be
have
called
her
a midget.
chest- One of them has like the chest that doesn't expand.
Mm-hmm. I think that's more of the dwarfs. But she, but she'll tell you.
Genesis imperfecta as well.
But she'll tell you I'm a midget. Dwarfs are a little smaller than midgets. You gonna have to get it corrected. It's like you talk to someone that's Asian. They like I'm Asian. No, I'm not Chinese, or I'm Vietnamese.
Oriental.
Yeah, you have to correct it, and they're gonna correct you. No, I'm a midget. She's a dwarf. I'm not a dwarf.
Well, if she says it, that's one
Yeah.
thing, but I'm not going to call anybody that. But I understand there are differences. That is a very
Yeah,
good point.
that's the height.
I was gonna say, I had a teacher in Galveston, and she was lacking one chromosome, and she wasn't like that, you know what I mean? But she was like very, very short. She was like 4 foot. And she was getting married, and like she was tall, and I mean, like she would just wear heels every day to work, but she didn't have
And
like,
still was super short.
she wasn't like pterodactyl arms.
Yeah.
Oh.
No, exactly. No, because they
Now, that's not
and they
offensive.
kind
Pterodactyl
of
arms.
almost like Down syndrome, like stubby fingers.
She didn't have, she was just very small.
Yeah.
Small lady. And I was like,
What did she teach?
She got her master's in somewhere in Houston, I can Prairie View, and she did psychology. So she
Oh,
teaches
wow.
lifespan and general psych.
Interesting.
Yeah, she was so sweet. And it was Kavika Irvin.
You'll never forget her.
Yeah, maybe you did.
I always tell people, y'all know Dawson High School in Pearland? I had Linda Dawson as our teacher at Pearland High School
She
years
was
ago.
with a little dread. Yeah.
So, that's my story. Okay, before assisting with an LP, lumbar puncture is a spinal tap. It's the same thing. 10-month-old So maybe they have concerns that the baby may have meningitis. Why would the nurse apply cream to the spinal area? Yes. Thing about cream, though, you really have, it's not a real quick thing. You gotta allow enough time for it to be effective. So remember that with Imla. What should the nurse, a nurse caring for a hospitalized 4-year-old boy with CP do?
Okay, I saw this TikTok. I'm sorry.
Yes. Yep, very good. See, probably have to support that head, support that neck, support that chin. Just think about, remember it's a muscular coordination thing. So you're going to have to assist with a lot of things. And if they get in a compromised position, you might have to reposition. How should the nurse address a 12-year-old with an IQ of 67? Absolutely. The nurse sees a 5-year-old fall on above his head in the parking lot. What question should the nurse ask? John.
Yep.
Good job. Y'all need a break before we do the next one? Yes? Only like 10 minutes?
Yeah, fine.
This one's almost as long. These are kind of longer. Okay, I'll be right back. Yep. Ptosis of the left eyelid, left upper.
That one eye doesn't open. It's like that one eye doesn't open.
Bye, chickadee. Be careful.
Are you serious? No, I studied like 2 or 3 days before. No, I studied for mine. I would have either both of hers or I don't know. I would have been like, yeah, I showed you the name or you would have okay, this is what that's an everything show. I know. It was almost there. But the white thing, hey, did she miss the good part yesterday?
We got searched.
Oh, yeah.
They give it back
Why they searched y'all at TDC?
because a nurse gave the inmates a phone Sunday, so they was on lockdown.
Baby, she lost her license behind some bullshit.
They said Travis said that's a felony charge.
They arrested her?
We don't know who it is. We just
They at a hospital. I don't know if they arrested her for that, felony for that.
yes, it is because it's considered TDC jail.
Oh.
So they still, they not supposed to have phones at all. They're not supposed to give them. We got like little offices over there.
Yeah?
I have a great address because I had
Either with the version
Choosing its GPU.
they're gonna take medication.
Bring it up together. From the, I was like, I'm already done. It's okay, I'm just like, that
I told her, don't put stop.
Yeah, even though I look crazy. Nobody knows that.
I've been in class. Who's texting? Who's texting?
Yeah.
Who else texting?
It's okay.
One thing. Stop first.
It's okay.
But wait till you let your phone sound like you know all stuff in my face. Your
What kind of pictures guys
Hey, I haven't even edited it.
the photos that I sent?
That was really not that bad. That's cute.
I've already edited it out. Yeah, I'm just back here listening to editing. What you're hearing is the fan giving out because it's working
I might use this to keep my doors. Yeah, baby. Oh, cute. You think I can use that? Yeah. You think I can use this? Why not?
It's good on this new stuff. Awesome.
Probably.